we're reporting 146 new cases today in the community. 124 of those are across Tamaki Makaurau, 14 are in the Waikato, 4 in Bay of Plenty, and 1 new case in Nelson Tasman region. The one new one in Nelson Tasman is in addition to 3 that we reported yesterday, but they are officially being added to the tally today. There are also 3 new cases in managed isolation and recent returnees from abroad. In terms of hospitalisations, there are 83 people in hospital today. 2 of those are in the Waikato, and all the rest are across Tamaki Makaurau. So of those in Auckland, 5 of them are in ED or an assessment unit, so 78 are actually on inpatient wards. 9 of our total number of patients in hospital are in an ICU or high dependency ward.
Final word today for me on Omicron. Understandably, there is a bit of anxiety about this. I want to be clear, it's a cause for concern, but it is not a cause for panic, and we'll be keeping things under constant review. Our readiness and response planning in the event of a new variant of Covid-19 entering in New Zealand remains the same as it has been for previous variants, and that we are ready and we have plans in place. Knowledge continues to emerge about the B11529 variant. It's still in its infancy, and we're watching closely and monitoring the evidence internationally. More information is likely to become available in the next few weeks. In the meantime, we do remain in a good position to minimise the impact any new variants have on our border settings, because we've got that ability to still do 14 days of isolation for the people coming into the country from those higher risk locations. And the management of their cases and their contacts, as we've been doing for some time now, continues to be really important there. PCR samples, the test samples, from any cases that are identified at the border are being prioritised so that we will know as soon as we can. They're being prioritised for whole genome sequencing, I should say. We'll know as soon as that variant arrives in New Zealand, if it does. The World Health Organization keeps reminding us that in order to defeat the pandemic worldwide, we do have to use a comprehensive approach, which includes vaccination in combination with proven public health and social measures that we know already work. So it remains important that everyone right around the country continues to play their part and be vigilant. Vaccine producing companies have started assessing how effective their vaccines are against this new variant, and again, we're following that very closely. Our advice to the public remains that vaccines are still the #1 protection against COVID-19, and that includes against the Delta variant, which is responsible for our current outbreak. There's no change to the advice on booster vaccines, which is for people over the age of 18 to get their booster dose at least 6 months after their second dose.